Welcome to Health Lit, your health education channel. Burning sensation in the chest region after eating and at night time. Painful sensations that increase while in a reclined position. Unpleasant acidic and bitter taste in the mouth. It is commonly mislabeled as heartburn, but the medical term is GERD, which stands for Gastroesophageal Reflux Disease, also known as acid reflux. Let's break it down. Gastro is a compound word that is used to describe the stomach. Esophageal is a word to describe the esophagus. Reflux means the process of flowing backward. Disease means anything pertaining to the body that is malfunctioning. Note, acid reflux and GERD, which stands for Gastroesophageal Reflux Disease, refer to the same condition. However, GERD is when acid reflux is a recurring condition that leads to further complications. In other words, GERD is acid reflux in its advanced and harmful stages. Acid reflux and GERD, Gastroesophageal Reflux Disease, will be used interchangeably throughout this presentation. Another word that will be mentioned throughout this presentation is LES, which stands for lower esophageal sphincter. What is the stomach? The stomach is part of the digestive system. It is situated between the small intestine and the esophagus on the upper left side of the belly. It is an organ that is shaped like a sac. The stomach combines food with digestive fluids and grinds it into a fluid combination known as chyme. The small intestine then receives the chyme for additional digestion and nutritional absorption. The stomach aids in the early stages of food digestion and controls how quickly food enters the small intestine. What is the esophagus? The muscular tube that joins the throat and stomach is called the esophagus. The peristalsis, or repetitive contractions of its muscular wall, is what moves substances such as liquids and foods from the mouth to the stomach. A mucous membrane lines the esophagus to shield it from the stomach's acid and digestive enzymes. The lower part of the esophagus, called the esophageal sphincter, LES, is a ring-shaped muscle at the lower end of the esophagus. It opens to let food enter the stomach and closes to stop the substances in the stomach from traveling back into the esophagus. GERD, Gastroesophageal Reflux Disease, aka acid reflux, is a condition where stomach acid flows back into the esophagus because the LES has been weakened or is malfunctioning. What causes GERD? Numerous causes can contribute to GERD. Common causes include, among others, a condition known as a hiatal hernia occurs when the top portion of the stomach pushes through the diaphragm. This might weaken the LES and allow acid to travel back into the esophagus. Obesity, being obese or overweight, can put more strain on the LES and stomach, which can lead to acid reflux. Pregnancy, as the uterus expands, pressure may be placed on the stomach, which may result in acid reflux. Smoking, nicotine can erode the LES, which facilitates the reflux of stomach acid into the esophagus. Certain drugs that weaken the LES or increase stomach acid production include several painkillers, antidepressants, and asthma treatments. These drugs can also cause acid reflux. Acid reflux can also be caused by gastrointestinal problems such as dyspepsia and peptic ulcer disease. Unhealthy eating patterns, eating big meals, eating after hours, and eating particular foods, such as spicy or acidic foods, drinking alcohol, and taking caffeine can all raise the risk of acid reflux. What are the complications of acid reflux? The consequences that can result from acid reflux, commonly known as GERD or Gastroesophageal Reflux Disease, include esophagitis, esophageal inflammation brought on by the tissue being exposed to stomach acid. The lining of the esophagus becomes altered in Barrett's esophagus, which raises the risk of esophageal cancer. Strictures, narrowing of the esophagus brought on by recurrent acid reflux injury. Acid reflux can result in chest pain that resembles a heart attack. Tooth decay. Tooth decay is a result of stomach acid eroding tooth enamel. Acid reflux can irritate the airways, which can cause chronic coughing and wheezing. It's crucial to keep in mind that not everyone who experiences acid reflux will have the same causes and symptoms. To determine the cause and develop an effective treatment strategy, it is best to speak with a healthcare practitioner. What can be done to minimize or eliminate symptoms of GERD? A number of methods can be used to alleviate and avoid acid reflux. Changes in lifestyle, losing weight, staying away from constricting clothing, and avoiding foods and drinks that aggravate symptoms can all help to lessen acid reflux. Dietary modifications, eating less greasy, acidic, spicy foods, and not eating late at night can all help reduce acid reflux. Medication, both over-the-counter and prescription antacids, can help reduce stomach acid and enhance the lower esophageal sphincter's performance, LES. Raising the head of the bed can help stop acid reflux into the esophagus as you sleep. You should raise the head of the bed by 6 to 8 inches. This can help to prevent the reflux or flowing back of the contents from the stomach into the esophagus. Avoiding alcohol and smoking. Gum chewing. Gum chewing after meals can aid in promoting salivation, which can help to neutralize stomach acid. Yoga, meditation, and other forms of deep breathing are all effective relaxation methods. Supplements including d-limonene, aloe vera juice, and probiotics are also reported to reduce acid reflux. For more information and tips concerning acid reflux or GERD, visit zeroacidreflux.com. Improve your health one step at a time, and have a wonderful and health-conscious day. If you enjoyed today's presentation, please subscribe, like, and share.